Okay, here we go. I am Tilman and I'm going to show you some self-massage techniques today that may assist you in your athletic endeavors. If you're a runner, or skier, or swimmer, or even a walker, muscles hurt and they can hinder you from doing what you want to do. Okay, we're going to start off here at the hip and thigh and work down the leg. What I'm going to get you to do now, first we're going to work with the muscles here in the lower back. Quadratus lumborum is here. You can use the L part of your hand, and with your thumb pointed backwards, you're just going to hold that muscle there like that. Okay? Find where it's soft or achy and just hold. You'll find that just by holding, your brain is saying, whoa, there's so much tension there now, the muscles will have to reduce some of that tension. So it sends a signal back down to the muscle, and the muscle says, whoa, okay, we have to reduce the tension. So it does that. Holding does that. Okay? Don't have to use your thumbs and fingers and move them around. Just holding it will work. Okay? Now, next one. You're going to find the piriformis muscle. It's attached to the long part of the femur, right at the head, right at the back of that bone. So landmark that bone. Now what I want you to do is you want you to fold your fingers and put your thumb on top of the fingers and place your thumb part in behind that bone. Now, all what you're going to do here is wibble your leg back and forth like that. It's pretty simple. If you're lying on your bed, try it that way. Okay, all what you have to do is anchor the hand in there, and the best thing is to have a surface where your head can sit on. Simple. Back and forth, that's great. Okay, now we're going to move over to the gluteus medius. Gluteus medius, if you landmark it, it's coming up from the back of the hip bone here. You can find a muscle border in between there. You have to dig around a little bit there. And then just hold that muscle. And again, turn your foot in and out or pivot your leg. And you'll be able to find that. If you want to do a stretch like this, lift your knee while holding that muscle. That would work really well too. Okay? Notice I'm not using my fingers. I'm just holding, and my body parts are doing the work. Just like that. Okay? Now another area around the hip bone, I hear that might be sore, is the tailbone. So what you're going to do is you're going to work the margins of the tailbone itself, and then find the sit bone, and then you'll find from the sit bone to the sacrum is a ligament. It's called the sacrotuberous ligament, and if you hook onto that and then just gently lift the knee up and down like that, you'll be able to stretch out the fibers at the sacrotuberous ligament. Not an easy one to get, but good luck. All right, from there we're going to work to the front of the hip, and here we have now the tensor fasciae lata and the gluteus minimus muscle right at the bend of the leg here. It's an important area. Place your thumb in there and then stretch them out. Stretch out the leg while you're holding that point. If your thumb is weaker, put your other hand on top of there and stretch that out. Simple. Okay? You might find that this point here, you even bend your leg back and forth like that, if it causes pain running to the back of the hip, it could be that it's not piriformis muscle issue at all. It could be right in front, so everything is tight, and so that might release it. Okay? Good luck. Now, another place here is the psoas muscle. And so what I'd like to do is crook my fingers. I don't like when I poke myself in there, but crook my fingers in there. See my knuckles. And then I'm doing a pelvic tilt, trying to find that muscle and landmark it, and then stretch the leg out like that. And that takes some of the tension off the psoas muscle. There's a better stretch for that. And maybe next time I'll show you that. But this one here works right now. We're doing self-massage techniques. From there, we're going to work the quads. Okay? Use your forearm, place your quad, or your forearm on your quads, and again, all what you're doing is holding and allowing the muscle or the leg to work and moving your leg against your forearm. That's the quads. Pretty easy. Now, we're going to go for the hamstrings. Hamstrings are really nice. So what you're going to do is you're going to put a towel, or if you got long pants on, that's fine, great. If you don't, use a towel so that you don't rip your skin, And so what you're going to do is you're going to find areas of the hamstring muscles that are tight, and then just stretch them out. So all you're going to do, stretch them out, crook your fingers together like that, hold the muscle, and then stretch out the leg. Simple. Okay, so you're just holding and stretching like this. And that will release a lot of tension in your hamstring. You'll probably be able to run a little bit better. Okay, just like that. But Tilman, what about the adductor muscles? Oh my God, the ones on the inside. All right, so you can put your towel on the inside here, and then hook the muscles on the inside, and then move your knee towards the center like that. And that will take some of the tension off. The adductor muscles, you can work right up into the crotch area. But there's better ways, and I'll show you in a second. Okay? All right, now next one, you're going to work on the lower legs, and the first one here is posterior tibialis. That one is responsible for all the shin splints that you get in the back of the leg. Okay, so you put your thumb, long part of the thumb, not the tip, but the long part of the thumb, on the inner side of the bone there. You can find the bone, and all what you want to do here, put your foot down, and then bend your ankle back and forth like that, and you'll find that that muscle will be working against your thumb. Not your thumb against the muscle, but the muscle is going to be working against your thumb. Very, very easy. It might be painful, but that's a good thing because you're working it, and you're going to help yourself get a lot better and take away some of the pressure there in the back of the leg. These muscles will also, if they're tight, have an effect here on the back of the heel, and it might get you to think that you've got an Achilles problem, whereas it's probably just tight muscles. So, gastroc muscles. Also, bring your thumb in downward position right at the crook of the back of the knee, if you want, and then again, stretch down, starting with on your toes, and then lower the foot, just like that. Simple, simple, simple. Okay? Now, working on the front here, these muscles, you find the bony margin here in the front. It takes a curl right at the top here. I want you to hook your fingers right at the bony margin. Group your other hand on top so you add a little bit more pressure. And then all what you're going to do is extend and flex the foot, just like that. Up and down, you can do little circles, and you'll find that that might be a little sensitive too, right at the bony margin. It's a good thing because you're working these muscles and it's going to take some of the tension off. So if you've got some issues with shin splints, then these are the muscles that are going to be working it. Okay, just like that, back and forth, do some circles. Okay, find another area, put your other hand on top of the other ones, and then again, work it. Worky, worky, worky. Good. Now, there's another muscle here that is a horrible muscle. It's called the peroneus brevis. Okay, and so it runs from about mid-leg all the way down underneath the back of the heel and attaches onto the foot here like that. So if you've gone over on your ankle, this is the muscle that's going to be stretched. Could be also damaged, scar tissue, torn. I've done it a few times. So what you're going to do is you're going to put your thumb in a downward position like that, pointing down to the heel, and you're going to grip your fingers around the front of the leg, and again, drop your heel down. Simple. Okay? This will take some of the tension off. You'll feel the pressure there. Again, you're applying a little pressure with your thumb, not the tip, but the whole length of the thumb, and allowing the muscle to work underneath there. Just like that. Okay? It's a muscle that needs to be loosened off, and this is the way to do that. At least that's the way I've found it works best for me. You might find a different way, but for me it works. Now, you're going to work the plantar muscles. Oh, the plantar muscles. So these are the muscles here. They start off here at the heel and run this way on to your foot. Okay? Now, what I'd like you to do is group your fingers around that part of the foot and then stretch them out like this. Okay? If you can't work this yourself, get somebody to help you. Okay? There's nothing wrong with asking for some help. And if you're going to get them to somebody else to work on you, you show them how it's done. It starts here. It's not all over the place here. And all what you're doing, you can say, just hold your fingers there. Let me do the work. Okay? I just want you to hold it so I can stretch them out. Okay? Works well. Okay? Now, oh, there's another area here. So a lot of people have bunions, right? And so bunions, my theory is that it comes from stubbing your toe, and then of course all the muscles tighten up. Where the muscle's going to go, the toe's going to migrate over into the middle of the foot. Okay, here we have the small lumbricals in between here, and so what you're going to have to do is work these areas out like that. Okay, and so I've found that even some bunions have corrected themselves if they're not too far. It's just a matter of getting that joint moving again and getting to open up a little bit. Where it's compressed and really tight, it just needs to be loosened off. Simple. Okay, so work in between the toes here, very, very important. Okay, even pull on the toe, that works too. Okay, very good. Now, some people have asked me, well, Tilman, what about foam rollers? Oh, foam roller, yay, foam rollers. Okay, now, what can we do with the hamstrings? Oh, the hamstrings. So you sit on the foam roller like this, right in the crack, and then you're going to use a chair and you're going to roll your thigh on the foam roller like this. Notice here in this position, the muscle is all loose. Oftentimes people will roll on the floor. The muscle is tight once on the floor. It's not going to perform the same way. Change the position of the roller and use the whole hamstring muscle. Lean forward a little bit, and then you can get right up at the adductor muscles as well. You can do the adductor same way. Okay, great way to use the foam roller. But what if you don't have a foam roller? Oh, Tilman, I've got something for you too. Oh man, is it a soda bottle? Yes, it is. So you sit on the soda bottle and then you're just rolling on the soda bottle. Okay, works, and it's a hell of a lot cheaper than a foam roller. Okay, you can switch it up as well. Lean forward a little bit, get right in there and do the adductor muscles right towards the crotch area. You can get right in there. That works really well. Soda bottle, who knew? Okay, so massagers. Oh, massagers. This is the nicest one that I found, actually. There's many out there. This one has a nice long handle on it, 2 mechanical bulbs. That works really, really great. Okay, for me it works great. I use it in my practice a lot too. So where do I use it? I use it around the back of the bum area here, at the tailbone area, use it on the hamstring muscles, use it on the adductor muscles. If it's too sensitive there, you use a towel, fold it up a couple of times, and then put the bulbs on the towel, and that's going to be a little bit easier on your skin and on the sensitive parts of your muscles. Okay, so you can use that then here all the way up into the crotch area if you wanted to, and continue back down again. Where is it also good, Tilman? Well, it's also good here in the lower leg muscles. Okay, on the calf muscles. Oh my goodness, so nice there. How about on the front? Yes, you can also work on the front there too, like this. How about on the foot? Oh yes, works great on the foot here like that. So you get right in on there and work it on here. Do the toes area. If you're going to do it on yourself, you might not be as sensitive as if somebody else were to do it on you. Okay, so that's the massager. Okay, they're really inexpensive. They really come down in price. This one here is a Homedics massager, and I get that at the drugstore for $70. $70. How about that? Okay, so that's it for self-massage techniques for the leg and the hip and the lower back. Have a great day and see you next time. Bye for now.